Hello and welcome to Health Digest. Mental health emergencies are becoming increasingly common, and yet they remain among the least understood crises in our society, from sudden panic attacks and suicidal thoughts to psychotic episodes. These emergencies can strike without warning, demanding immediate attention, compassion, and professional care. But what truly defines a mental health emergency, and how do clinical psychologists help stabilize and diagnose and support patients in such critical moments? On today's edition of Health Digest, we focus on mental health emergencies and the crucial role of clinical psychologists in preventing tragedies and restoring lives. My name is Ogom Ezedimbo. Welcome.
As the world gradually returns to normal following the disruptive effects of the coronavirus pandemic, medical attention refocuses on old ailments the world has been grappling with. That is why AIT's special health program, Health Digest, brings to you the latest developments, reports, and analysis on topical issues that concern your health. Watch Health Digest, showing on AIT every Wednesday and Friday at 6 p.m.
On the program today, we have our guest, Pamela Udoka. She is a National Publicity Secretary, National Association of Clinical Psychologists, and she's also the lead therapist, Family Wellness Therapy Center. Thank you so much for joining us.
Thank you very much for having me. Thank you.
So let's quickly understand what qualifies as a mental health emergency.
Well, without blowing too much grammar, let's just look at the society. You hear people say, I'm going through a lot. You hear people say, oh, my mental health, every little thing, my mental health. If you circle back like 4 or 5 years ago, we're not hearing such terms. So it tells you that something is happening in the society that people cannot put their finger on. People cannot put their finger and say, this is what's going on. They just put it in a cluster. Oh, my mental health, I'm going through a lot. And what constitutes going through a lot for one person is not the same thing as going through a lot for another person. Okay? So it is now becoming an emergency, a crisis, where people are going through a lot of things. Like you see them responding to traumatic situations, you see aggressive behavior, you see verbal aggression, all those things. People are just smiling, going through the motion of just moving around every day, but they're actually going through individual issues psychologically and mentally, and they don't know how to handle it. So it's rampant now.
So which means it comes in different forms. What are those factors that you know when you say mental health? What are the branches of this mental health?
Well, when we talk about mental health, we talk about mental health disorders. We talk about depression, you know, the common one. We talk about general anxiety disorders. We talk about emotional dysregulation. We talk about suicide ideation. We talk about substance abuse. You know, all those things are happening now in ways that were not that glaring before. So people need to respond in specific ways to cope with what they are going through. So it becomes a mental health emergency because we need to really handle those kind of situations.
So what are some of these early signs we can see and say, okay, this person is actually slipping into a mental health emergency?
Yeah, behavior observations. You know, people change in behavior. We call it a pre-morbid state, a way a person was before, and after some time you start seeing changes in the way the person expresses his or herself, the way the person talks or does not talk. Either the person represses and stays quiet, withdraws to self, does not want to respond to certain situations, does not even want to take a bath sometimes, you know, but maintaining poor hygiene, or lashes out at little things. You expect a reaction over little things, the person overreacts. The person, sometimes some people hurt themselves. So when you observe such things in a significant order, you know that something is wrong with that person. They either point the person to the direction of help, or the person, sometimes people realize that, oh, I need help. And sometimes it's not even in a situation where the behavior is so obvious. It might be in a relationship, and the person is having relationship issues. There's, poor communication. There's a third-party interference in that relationship, so it affects how they relate with each other. And then that affects one person. The other person now maybe breaks down because he cannot handle the crisis in that relationship. So it manifests in different ways.
But let me get you correctly. For example, you have someone who is calm in nature. This person is so calm.
Yeah.
And maybe the person is provoked not once, not twice, and you see that anger.
Yeah.
Could that person be exhibiting some disorders?
No, anger is a natural emotion.
Okay.
I mean, we are entitled to being angry, okay? But when the anger becomes what we refer to as dysfunctional, then there's a problem. You find cases of people who are in correctional centers just because they exhibited dysfunctional anger, okay? When the anger is something that the person cannot contain, okay? Then now reacts in a negative way. That's when it becomes an issue. That's when it needs to be managed. It needs to go through anger management. Okay, but you can be angry. I mean, we are human beings. We are entitled to some percentage of anger, but not the one when it becomes dysfunctional.
You are a lead therapist.
Yes.
How often do you see these people? What's the statistics of Nigerians going through this mental health issues?
When I refer to myself alone, it's just a tiny percentage, maybe 0.001%. But when you talk about the Nigerian Association of Clinical Psychologists as a collective, the statistics of Nigerians we see is not enough, because many people do not access our services. Many people are not aware that these services are available. Many Nigerians are not aware that we can access these services for their mental health. So that's the issue. So genetic statistics is below par to what we should be having. So we can't say, oh, we are saying 10% of Nigerians, 50% of Nigerians. No, but what we should be saying is not enough. That's why we're saying, please, Nigerians, help is available. Access clinical psychologists for your mental health care. Okay? It's not enough to just suffer, but you can get help.
But from your own point of view, how do you see these people? Do they come like, when you talk to them, you know that some persons just walk around smiling and something is wrong inside? Yeah,
you see, when it comes to mental health, you don't have to wear tattered clothes on the streets before we know that, okay, this person has mental health issue. I can be properly dressed like this.
Walking on the streets?
Walking on the streets, interacting with you. Yet I'm going to stuff that you don't understand. But with a professional eye, a clinical psychologist can listen to that person or observe that person, assess the mental state and know that, yes, this person is going through.
So if I'm talking to you now and I have some issues, you know that something is not...
Yes, there's a way you behave. There's some the symptoms that you will exhibit that I will observe as a professional. That will catch my eye. That will know that, yes, this is what you're going through. These are the symptoms you're exhibiting. And those symptoms will give me at least a working diagnosis. When I now do my clinical assessment to confirm that diagnosis, I know that, yes, this is what you're going through. Then I can now map out a treatment plan for you.
Let's look at the Nigerian situation, the way we are right now in this country. Do we have an emergency?
I like the way you're doing this.
Because I really want to, because sometimes you just see, I was before we started this program, I had a discussion with you where somebody told me about a lady who is referred to as a jolly good fellow. She laughs, she smiles at everything. Everybody seems, okay, this is going well for her, until she's committed suicide and left a note in the room. So the Nigerian situation that we are right now, assess it from your own point of view as a clinical psychologist.
You see, there's something we call functional depression. Functional in the sense that the person can be going through all those symptoms of depression, yet be functioning. That's how a popular comedian years ago, he died by suicide. He was a comedian.
Makes people laugh.
Makes people laugh. That's his job. So I'm sure maybe when he was even telling people that, oh, I'm feeling this way, they'll be laughing, they're thinking it's a joke. So somebody can actually be going through depression and be functioning. But because the person did not access care, did not access help, because the person knew he or she was going through, or this particular day, she knew she was passing through some things that she couldn't help herself. She couldn't discuss with her partner, she couldn't discuss with her children, but she needed professional help. It's like having a physical ailment. You have headache. You see a medical doctor. Your leg is paining you. Want to go to the orthopedic hospital. So when you are feeling heavy emotionally, you don't understand what's going on. You can't help yourself. You access mental health services. They're all over the country. So and get help.
It's actually something to be worried about, because the rate at which people are going about life, the way people see life, I know we all look at things, but we see it differently.
Yes.
So many things are happening economically, family-wise. There's so many dysfunctional things happening in the homes and the environment. So it really calls for greater awareness, to put mental health emergency forward, to tell people that this thing is actually real.
Yes.
But how many people really want to accept that I'm going through this problem? Now, between going to the church, seeking help, because now you see people, okay, fine. Can somebody actually pray out mental health issues?
No, we have what we call the psycho-spiritual dimension.
Okay.
So we understand that Nigerians are spiritual, they are religious. So we do not discountenance that fact. So when somebody is exhibiting certain symptoms based on religious beliefs, we validate those thoughts, we validate those beliefs, but now guide the person to gain insight to know that the way you are expressing those religious ideas is abnormal. Do you understand? So we do not say, oh, no, religion is wrong, your spirituality is wrong. No, we understand that, yes, there's a spiritual lineage to the Nigerianness. But when you start maybe having some delusions around the spirituality or delusions around your religion, which we see some cognitive distortions in the way you express yourself, and your family is against, or they don't understand what is going on with you, then we know that, yes, this has that dimension. So we professionally look at it that way, okay? But we do not just say because it's a spiritual issue, or because you came to with a spiritual dimension, it is wrong. Oh, we must stop it. We must cut short your ideas. No, we understand that there's a spiritual dimension, just like the cultural dimension. So if you see cases that lean around religion or culture, you apply the knowledge of that religion or that culture to treat the issue. But you do not say, oh, don't go that way. When you come to a clinical psychologist, you are not coming for prayers. You are not coming for deliverance, okay? You're coming for professional service. But it behooves you as a Christian or as a Muslim to pray that the therapy that the therapist is giving to you works. Do you understand? So we work hand in hand, the professional and the cultural and the spiritual dimension. But we know where to draw the line without downplaying the other parts of the societal norm.
Now, we used to say, be your brother's keeper. Do we still have all of that? What role can families or friends play to respond effectively when they see signs of a friend or a family member going through all of this?
The fact is, being your brother's keeper is very vital, because it is that brother that will observe issues going on with the significant other.
Do we still have that in place? Because looking at the situation in Nigeria...
Now, I think everybody is like, every man for himself or herself. I think that's what's going on. Everybody's fighting like a selfish battle. We would not have that communal living again, where we gather ourselves, maybe under the moonlight, and tell stories. Maybe if somebody is not around, you know that, oh, this person didn't come out this evening. Why didn't she come out? Is she still in the farm? Or is she tired? Oh, go and call so person. We don't do that anymore. Everybody is in isolation as well. We are just watching our own television, either pressing our phones. We don't care about the other person. Even within families, you can see families during dinner time or during meal times, people are eating by pressing their phones. They're not talking to each other. So that's why we are talking about crisis, emergency. We are not talking. We are not relating with each other anymore. We are relating with our gadgets. Okay? So it becomes an issue when you don't observe your family members. You don't observe your friends. So you do not observe the change in behavior that warrants mental health assessment or mental health care.
So what can we do?
What we are doing now, creating awareness, letting the people know that this way of life is not helping the nation. That we have to reverse back to the way we were before, or find a way around how we are now. Maybe put laws in the house. When you come home, drop your phones and talk to each other, look at each other in the eye, ask questions. How are you? How was your day? You know, not messages. Messages cannot express emotions. Messages don't hug. We have memes that, you know, express, but when you physically hug somebody, then you will know if the person has temperature, the person has high fever, the person is not happy. Sometimes just a hug, somebody cannot verbalize what they are going through. You can just hug somebody, the person starts crying. Then you know that the person has some emotional needs. But if you don't physically interact with that person, you will not understand, you will not know.
Now let's come down to clinical psychologists.
Yeah.
We have an emergency in our hand, whether
Yes.
we like it or not. There's a mental health emergency
yes,
in the
there is.
country. Do we have the number of psychologists, clinical psychologists, to address these issues?
My answer is, we've been two-pronged. We do, okay? But the fact that we have gaps in the sense that we don't have our bill, the psychology bill has not been assented to. So that gap allows for quacks to penetrate the system and assess Nigerians without the prerequisite qualification and experience. So the unqualified ones who just do maybe 3 months online course come back and give themselves titles as therapists. They want to treat people, and they are not qualified to treat people. They are also adding to the emergency because they are creating more harm. Because they are not treating. They are leaving the people worse than they met them. Now, the ones who are qualified, we cannot serve everybody. Okay? That's why, you know, most trainings are going on. Even in our just concluded conference, we had what we call continuing education training workshop. So there's continuous training more clinical psychologists to be able to attend to Nigerians. But while we are doing that, we need to bridge that gap so that quacks will not, you know, evade the space and create more harm and create more emergency than we can handle. Okay, that's why I say I'll answer it in 2 ways. So we have, but even though we are not enough, but let's not give room for quacks.
Okay, so professionally, we are short of clinical psychologists.
We are.
So if we have one massive outbreak like this, no, we don't have enough hands to cater to the over 200 million people that we have in the country.
We don't have, but the training
that's going on, we help
more schools, bringing to the, we are going to live up to the expectation, but definitely we need more clinical psychologists.
Apart from private establishments that run therapy centers, and do we have enough centers in Nigeria, like public-owned centers to take care of mental health issues?
Yes, we do. We have the Federal Neuropsychiatric Hospitals. We have, even in Abuja here, we have the Carol General Hospital. We have the Federal Medical Center. We have clinical psychologists in those places. Okay, we have all over the country. We have federal medical centers all over the country.
All of this seems to sound like they are all in the urban areas. We have in our primary healthcare centers, we have professionals stationed there that will help to address these issues arising from the grassroots.
That also brings me to employment. Government has to employ people in these places. Okay, because even though we have clinical psychologists, not all of us are employed in strategic places. Where you have mentioned now, we need more clinical psychologists in those places. Not just having one clinical psychologist or 2 clinical psychologists. No, we need more, because the 2 staff you have employed will not be able to take care of the thousands of cases that come in. So you now see the 2 clinical psychologists suffering burnout. You know, they are stressed out from seeing patients.
And that will make the clinical psychologists to now be depressed.
In fact,
so the clinical psychologist that is supposed to take care of the mental health of a patient becomes the emergency.
In fact, so we need government to employ more clinical psychologists in those rural areas to be able to assess those who are not in the urban areas. Okay? You also see that in the association, we have state chapters. Apart from the national, which I belong to, we have state chapters. We have zonal chapters. So those states also penetrate the other areas, the local government areas. So we need government to also help us employ clinical psychologists in those local government areas to help in the medical centers around there.
Now, what do you people do as your CSRO? Do you go to communities to create awareness, to check people, to know their mental states? Do you do all of that?
Yes.
Or you just gather yourself and do conferences, talk, and then you go?
We do all those. World Mental Health Day, let me just take off back, October 10, World Mental Health Day. It is mandatory that all state chapters organize activities to create awareness around the World Mental Health Days. And this takes them to all those rural areas that I'm talking about, to schools, primary, secondary schools, colleges, markets, to create awareness about mental health. So that's CSR. Nobody pays for that. Okay? And you see, when there's a crisis, like the COVID-19 crisis, we had psychosocial support. We volunteered. I know Lagos State had psychosocial support team. I volunteered to be carrying out therapy for those who were diagnosed with COVID-19. Okay, so we do that. It's a CSR. So sometimes we even organize ourselves and speak to students, speak to market women. We just offer CSR because we need to create awareness. Because if people don't know what's going on, they cannot access the help. So if we speak like this or speak at church gatherings, then those who really need to pay for the services will not come to pay for the services. But we offer CSR a lot. Okay,
Dr. Udoka, before I allow you to go, I want you to finally, your message to anyone who is probably going through, struggling with a mental health crisis, or someone who is caring for someone who is struggling with a mental health crisis. I just need your final word for them.
There's help. You know, there's help. Apart from us requesting government to assent to a psychology bill so we can clear the stable of quacks, we also need to tell people to seek out professionals, even the media. You know, you help us disseminate information that you have already fact-checked, you know, so that when people read, they will learn from what you're doing. Before you write, you can consult clinical psychologists to guide what you're writing, so that when the public reads, they will get information. And it's that information that they will rely on. And also, if you know somebody who is going through a mental health issue or a psychological issue, please reach out. Reach out to the appropriate, experienced, licensed clinical psychologist, not just anybody you meet on social media who claims to be practicing the profession. Because if you meet a wrong person, you will be creating another emergency from the known emergency. So if you meet a professional, you will help the person you have referred to get better help. And also, all of us are not general practitioners. It's not everybody you refer to me, for instance. If you come to me with somebody who has issue with substance use, that's not my niche. I will refer you to my appropriate colleague whose expertise that is.
Substance use, okay.
Yes, if somebody has suicide ideation or has attempted suicide and you bring them to me, I will refer to my colleague who's expert. So we have different areas of expertise. So that goes to show you that in the Nigerian Association of Clinical Psychologists, we have lots of experts, okay? So don't be scared that, oh, your case cannot be, it will not be taken care of. Your case is peculiar. It's only you that's suffering. That can, no. I bet you that your case is recorded in our DSM, our Diagnostic and Statistical Manual, and we have experts in each area in this country. Believe you me. So don't relent, don't relax, don't stay back and say, oh, they cannot help me, my case is beyond help. No, please.
So give your last advice, because we are going through a lot in this country. So
Yes,
talk to us
please,
as a clinical
please.
psychologist.
Stop, like I tell my clients, I say, stop enduring what you should be enjoying. Stop suffering in silence. There is help for you. We have clinical psychologists in Nigeria, in their thousands, all over the country. If you reach me or you reach the station, we have in anywhere you are in this country. And thank God now there's teletherapy. We can even work with you virtually. So you don't have any excuse to be suffering in silence when you have your clinical psychologist to work with.
Oh, thank you so much, Pamela Udoka. She is the National Publicity Secretary, Nigerian Association of Clinical Psychologists, and also the lead therapist, Family Wellness Therapy Center. Thank you so much for your contribution on the program.
Thank you so much for having me. Thank you. I appreciate it.
And one thing we must know is that mental health emergencies are real and they can happen to anyone. Recognizing the signs early and seeking professional help could save a life. As we continue to advocate for stronger mental health systems in Nigeria, and let's remember that empathy, understanding, and access to care are key to recovery. I'm Ogom. Just stay safe.